everyone, my name is Harshini Dasari, and I'm a student from Sunset High School. Today, I'm going to be talking to you about a pressing issue in our world, bridging the gap, overcoming inequities in pediatric cancer treatment. So a little bit about myself before I get started. My name is Harshini Dasari, and I'm a rising sophomore at Sunset High School from Portland, Oregon. I'm interested in pediatric oncology, bioengineering, and global health. I'm co-founder of a nonprofit called Hearts and Creative Hands, where we raise money for pediatric patients and cancer patients. We do this by using creative programs and summer camps like graphic design camps and ways to make art. I'm currently exploring the use of nanoparticles for targeted chemotherapy in retinoblastoma, which is a type of eye cancer, and it's targeted specifically towards pediatric cancer. I also love designing graphics and layouts. I really love graphic design. I also am a Carnatic singer and I'm a Bollywood dancer. I volunteer in my community and I'm exploring new foods and cuisines. So what is the problem? Each year, over 400,000 children are diagnosed with cancer. In high-income countries, over 80% survive, but in many low and middle-income countries, survival rate drops to below 30%. This isn't just because the cancers are more aggressive. It's because the healthcare systems are unequal. Kids are being lost, not due to the disease itself, but because of where they live. My goal today is to explore why these gaps exist, how they impact children and families, and what we can do to close that bridge. The truth is, when it comes to pediatric cancer, a child's chance of survival often depends more on geography than medicine. The same disease can lead to a very different destiny, simply based on where a child lives. In many regions, cancer is diagnosed too late, not because the parents don't care, but because there's no trained professionals, no diagnostic tools, and no awareness. Even if a diagnosis is made, families face impossible odds. Care centers are too far, hospitals are under-resourced, and treatment costs lead to financial ruin. And this is beyond the physical. Many children receive no palliative care or emotional support, and this makes their journey even more traumatic than it needs to be. These aren't just gaps, they're deep structural inequities. And for millions of children, this means that surviving cancer isn't about biology and science, it's about access. Let's look at this case study, for example, where we can see how geography can determine the outcome. Let's take Amina. Amina was 6 years old and lives in a rural village in sub-Saharan Africa. Like many children, she began to show symptoms of leukemia, fevers, bruises, and fatigue. But in her region, there were no pediatric specialists nearby. No way for testing. Testing took her months. By the time she was diagnosed, her cancer had progressed from stage 1 to stage 4. Her parents traveled hours to a hospital, paid everything they could, and hoped for a miracle. But the system had failed her. She passed away even before finishing treatment. Let's take Sophia for example. Same age, lives in Seattle, Washington. Her pediatrician caught the symptoms early. She received immediate specialized care plus counseling, insurance support, and academic services, and now Sophia is in remission. Amina and Sophia had the same disease, but where they lived decided whether they survived or not. This is the global gap that we need to fight to close. The gap in pediatric cancer treatment doesn't just appear. It's built on layers and layers of systematic barriers that children in low-resource settings face every single day. First, there's the issue of late or misdiagnosis. In many areas, clinics simply don't have the tools, like imaging machines or pathology labs, or the training to recognize cancer symptoms early. What's treatable in stage 1 becomes life-threatening by stage 4. Then comes limited access to care centers. Specialized pediatric oncology units are rare in many parts of the world. Families often have to travel hundreds of thousands of miles and even cross borders just to get to a hospital equipped to treat their child. Next, financial toxicity. Another huge factor. Even when care is available, the costs are overwhelming. Many families go into debt and have to choose between treatment and basic survival needs like food or shelter. Hospitals themselves are often under-resourced, lacking chemotherapy drugs, sterile equipment, or even consistent electricity. In some cases, children are turned away simply because this facility can't support their treatment for their disease. Despite the challenges, there are powerful innovations and interventions being developed at this moment to bridge the gap in pediatric cancer care, especially in underserved and low-income settings. One key solution lies in global partnerships. Organizations like St. Jude's Children's Research Hospital have launched global initiatives that provide free treatment, training, and research support in over 50 countries. These programs directly access disparities in access to diagnostics, chemotherapy, and supportive care. Another breakthrough is the rise of low-cost technologies, like point-of-care diagnostics and AI-assisted tools that can detect cancer earlier and more accurately. Additionally, nonprofits and community-driven initiatives are playing a critical role. For example, my nonprofit, Hearts and Creative Hands, and also programs that train local healthcare workers and deliver essential chemotherapy drugs at subsidized rates are saving lives. And we're seeing innovations in treatment itself, like tailored drug delivery systems, immunotherapies, repurposed generic drugs, and any drug that is more affordable and effective for pediatric care and use. But innovation isn't just technological, it's systematic. And changing how we fund pediatric cancer research globally is how we can prioritize equity in healthcare delivery. And how we involve patients and families in their care journey, all of that is part of the solution as well. I'll leave you with this. Around the world, a child is diagnosed with leukemia. In one country, might have a 90% chance of survival. In another, that number drops below 20%. Same disease, different destiny. But that destiny isn't written in stone. We, as students, scientists, advocates, and human beings, have the power to bridge this gap. Through research, through education, through policy, and through change. We can rewrite the odds. Whether it's volunteering for global health programs, raising awareness in your community, joining youth-led movements like mine, or someday pursuing a career that puts patients first, your role in this fight matters. Because no child, anywhere, should lose their life to a curable disease simply because of where they were born. Let's make sure it's not the disease that determines their future, but what we choose to do next. Here are my references, and with heartfelt gratitude, I'd love to thank the children and families around the world whose stories inspire this work. Your courage fuels change, and to the healthcare professionals and advocates fighting inequity every day, to the educators and mentors who've guided me, to the Global Healthcare Leaders Conference at Johns Hopkins for giving students like me the chance to speak and lead, and to my family and community, thank you for your unwavering support and for reminding me why this mission matters. Thank you for listening, for caring, and for believing that equity in pediatric cancer care is possible. Let's rewrite the story so that every child, everywhere, has a fighting chance. Same disease, equal destiny.